Hi, I'm Sam Tocco, and I'm here with my lovely daughter Renee Tocco, and we're both doctors of chiropractic. I'm in my 29th year as a doctor of chiropractic, and Renee is in her 3rd year, and we have some real important information about life, health, and wellness that we'd like to share with you. The first being, I wanted to interview Renee a little bit about having her tell us from her perspective what it was like to be raised in the vitalistic healthcare model, which means outside of the medical model without drugs or surgery and medical attention, but being raised healthy and drug-free. And many times during the course of my practice, I'll tell my patients that I've raised all of our children, 4 others besides Renee. 4 of them, by the way, are in their 20s, and my youngest son is 16 right now, but all of them were raised healthy and drug-free, which was quite an accomplishment. We're very proud that we were able to help our children live this way as God intended us to live. And another interesting thing is that we did it without having an insurance card. Many families would never dream of having 5 children and try to raise them healthy and drug-free without Blue Cross cards and some of this other stuff. But we looked at those cards as being more geared towards sickness care, and we weren't interested in that. We were purely interested in helping ourselves be healthy and remain healthy, and not have bad things happen to us. So as a consequence of that understanding, that vitalistic understanding, all of my children have been managed to be raised that way. And Renee has 2 of her own children at this point in time, and they're being raised the same way. So it is a very doable thing, and we wanted to share with you and maybe give you some encouragement and maybe looking in this area of how being raised this way as more that God intended. So Renee, what was it like from your point of view and to be raised this way without this medical attention that every family seems nowadays to be getting through the course of their life from cradle to grave, it seems like.
That's true. It was absolutely incredible. Growing up with a vitalistic philosophy, getting adjusted by, of course, a chiropractor, my father, living without antibiotics and over-the-counter pain medications and prescriptions was wonderful. As a result, most of us were healthy all of the time. If ever we were under the weather or experiencing some symptoms, we got through it quickly. They really say that if you do what everybody else does, you get what everybody else gets. And at a young age, I saw my friends and the different drugs they were on and their level of health. Absolutely. And now we have a whole country full of chronically ill children, adults, senior citizens, and
one of the sickest countries on the planet.
Absolutely, absolutely. And it's because of the fact that pharmaceutical companies run all of our advertisement. They've done a good job of convincing.
They're the healthcare providers, aren't they?
They've done a good job of convincing Americans that health comes in a bottle. And I don't know about you, but I've never seen anybody get healthy from a pharmaceutical drug in my life.
You usually get a lot of side effects and get a lot more unhealthy, and then they need more drugs and more of the problem.
And it's the whole principle of avoidance. And they say that nothing gets strengthened by avoidance. But people always want to avoid their symptoms. They want to try to avoid illnesses by getting shots. And we start out taking beautiful, perfect babies, and we inject them with toxins. And
wonder why they're sick all day long.
Absolutely. And then it just starts the cycle. So it was incredible to have the privilege of not being brought up in the allopathic medical model and being able to experience health to the level that we do.
You know what? Most times, I don't remember any of our children, your siblings along with you, having a problem more than part of a day.
Absolutely.
Usually it was a detoxification situation where you're probably just running a little bit or you're a little bit under the weather, but the next day you're back right on track again. And all of us don't wear glasses, including myself. None of our children do. And we just seem to be functioning about as good as you can. And when you do good things and you're understanding how your body really works, and when you really understand how critical chiropractic healthcare service is, then you can start to move in this type of direction. Just between you and I have the whole core of the care that I've produced with our family, this awesome level of quality of health and wellness without need for medical attention hardly at all ever. I have one broken arm. Curtis broke his arm in front of my office. That's the only time we ever went to a medical doctor.
Sure, and that's the perfect place for medicine, is in acute trauma care. If I have my arm torn off, I'm so glad to be here in America where they can sew it back on. But if you go in for their treatment on a monthly basis, some people on a weekly basis, your quality and length of life is going to be decreased dramatically, which is what we see being done.
And the reason why I want to talk is there are many people when I run around the country. By the way, I'm over here in Charleston. That's where Renee practices. And so I'm here in Charleston. And everywhere I go when I talk to people, very rarely do I hear people when I ask them this question, do you have a good chiropractor to take care of you and your family? Would they ever say, many times they say no. I knock on wood, I have had no need for one. So the serious need for chiropractic care and attention is the relationship between your spinal column and your central nerve system. Most people, when they think about the need for chiropractic, they think about bad necks and bad backs, and trust me, there's probably not too many people that have bad necks and bad backs, but they get focused on bone problems and not really the core central reason and purpose for chiropractic attention is to help your nervous system work the best that it can so that you can experience life, express life, and heal to the greatest of your ability. And when you're doing that, you get true health and wellness, and that's the central core for vitalism and non-medical model health care.